Wait a minute. Wait a minute.
Take the wheel. Just
Take the
the wheel just for 2 seconds. No, my wheel, actual. Carpool karaoke! No? Didn't catch that one?
I just totally, I was just thinking, I was like, how is this going to be perceived?
Hey guys, we're Brandi and Jordan, and today we're driving around doing carpool Q&A with Jordan, the physical therapist.
Hey guys.
Take 17. Take the wheel.
Okay, take the wheel. I got the wheel.
Carpool karaoke! We might sing for you sometimes.
She might sing for you sometimes.
I heard Jordan has a really amazing voice.
It's unlike any other. That's for sure.
So let's go ahead and get this game rolling. Is bed rest a better solution for pain or injuries than physical therapy?
So, bed rest is a position, right? So at times it's appropriate to be in bed. Okay, if you need to get into a position that'll allow the body to ease, the muscles to relax, the joints in the back to open up, to take some pressure off the nerves, sometimes it's appropriate, right? Bed rest is a position and it's appropriate for a certain amount of time. Typically the first 3 days or so, if you did a certain injury, again it depends on the type of injury, but after that, no, you need to get up and move. The body is designed to move, and facilitating that healing in an appropriate way, in the best position available, is going to help that healing. Increasing blood flow to the area is going to bring more oxygen, more nutrients to the area, and therefore allow for a quicker healing process. Whereas when you lay stagnant, there's decreased blood flow throughout the body, especially to that area needing it, and so it won't heal as quickly.
What do you believe is the most common misconception of physical therapy?
Physical therapy misconceptions. We are all ripped. I'd say probably one of the biggest misconceptions is that you come in and we just get you exercising. Physical therapists are trained in all kinds of different settings, neurological, vestibular, with balance and vertigo and stuff like that. Also, we do some adjustments, similar to what chiropractors do when it's appropriate, to help the joints get moving, and then we bring in the exercise. Exercise is a phase of the healing process, that kind of return to function. The thing that physical therapists push is how can we facilitate the healing without the use of medication, without the use of surgical equipment or needles, but everything else is pretty much game for physical therapists in that realm. So natural healing is what we emphasize.
All right, I like it. Do I need a referral to do physical therapy for my insurance?
In a lot of states, you don't need referrals anymore. Oregon's one of those states. You can, if you have an injury or an insult to tissue where you're in pain, you can just come right in and we can see you the first time. Depending on the type of insurance, we may send that referral on to a doctor for their approval if it's government type insurance. But other than that, no, we can see you just walking in the door and go on with care.
That's awesome.
We turned it? Man, she's
hey, you want to join us in carpool karaoke? Why do you like being a physical therapist?
I love being a physical therapist. It's something I've wanted to do since high school. I was never one of those kids that had an ACL tear and went to physical therapy and thought, oh, I want to be a physical therapist. I actually just was always enthralled by the profession, grew up with family that was that they were physical therapists, and thought that, you know what, I'm not behind a desk, I can move around, it's medical, so that means I can help a lot of people. So one of the things I love about physical therapy is looking at it from the outside in and the inside out, knowing what the body is able to do, and not everybody's meant to do everything, but one of my goals is to help people achieve their max functional performance in whatever that is, depending on their goal.
Why should someone see a physical therapist after an injury or car accident?
So not just after injury, as soon as possible. Okay? A lot of times, especially after a car accident, I've dealt with motor vehicle accidents my whole career. It's been noticed that a lot of times people will get out and they'll feel fine, but they won't feel the pain until a day, 2 days, 3 days later. And why is that? A lot of times it's the trauma of the situation. The body adapts really well right away, but then it starts to recognize as that trauma starts to leave, as what they think is hurting isn't the main issue, but there's other underlying issues that need to be assessed that maybe was masked by a bigger issue. Maybe they hit their head on the door and they weren't thinking about their back or neck at the time. And so they've been thinking more about the jolt on the head against the window. So getting in for an assessment as quick as possible, not just after a motor vehicle accident, but any injury, will help decrease that inflammation so that we can get on to the healing process.
Does being a physical therapist make you a better dancer?
A better dancer? I would say yes.
Well, I mean, I noticed Finn lost in his dummy downhill competition. Do you feel like your training had anything to do with that?
I don't know that the training was the issue. For anybody that saw the video, my heart was broken with yours, and we have made some plans and adjustments for the future as to how we will do that. Finn himself, he was okay. Sure, he broke a couple of things, but that was from the fall. That was a traumatic event.
Yeah.
Even the best athletes that fall off a ramp will get hurt.
Definitely.
So, no, the training was superb, and it's only going to help his recovery afterwards. Yes.
That's going to be for a blooper.
Okay. Okay. Redo. Just do a few takes on that. Do I jerk the wheel? Do I pull on? Do I drop it into neutral? What are we doing right now?
Okay. All right.